If you've been dealing with pain that improves temporarily and then returns, whether that's in your back, neck, shoulder, hip, or knee, this video will help you understand why that happens and what's often missing from the way pain is typically treated. I'm Dr. Lance Baumgard with Mobility Co Wellness. I provide mobile, in-home, and on-site chiropractic care and dry needling throughout Highlands Ranch, Sterling Ranch, and Littleton. Part of the work that I do is helping people who have tried different treatments but still feel like their symptoms keep coming back without a clear explanation. One of the main reasons pain returns is because the painful area is often not the primary driver of the problem. In many cases, it's the area that's absorbing stress from somewhere else in the system. The body is constantly distributing load across joints, muscles, and connective tissue. And when one area isn't moving well or isn't contributing the way it should, another area has to compensate. Over time, that compensation can lead to increased mechanical stress, tissue irritation, and eventually pain. For example, knee pain may be influenced by limited hip control or reduced ankle mobility. Neck pain and headaches are often influenced by how the upper back and shoulders are functioning. So instead of asking where is the pain, a more useful question is, where is the system breaking down under load? Pain itself is also influenced by the nervous system. And when tissues are repeatedly stressed or irritated, the body can become more sensitive in that area. This doesn't always mean there's ongoing damage, but it does mean the system is reacting to perceived stress. That's why symptoms can feel inconsistent. Some days better, some days worse, depending on how your body is handling load and movement. Many treatments focus on reducing symptoms locally, which can be helpful in the short term, but if the underlying movement pattern or load distribution doesn't change, the same stress tends to build back up. That's when pain returns. The approach I use is centered around understanding how your body moves as an integrated system. This includes assessing joint motion, muscular control, and how your body manages load during everyday movements like sitting, standing, walking, or exercising. From there, care is structured to reduce stress in overloaded areas while improving how the rest of the system contributes. Treatment may include chiropractic adjustments, soft tissue or fascial work, dry needling, and targeted movement strategies. The goal is to create more efficient movement patterns so that the same areas are not constantly being overloaded. This approach is not about chasing symptoms. It's about improving how your body functions so symptoms become less frequent and more predictable over time. Most people start to notice that their pain becomes less reactive and easier to manage as movement improves. My role is to help you understand what's driving your symptoms and create a clear, structured plan that makes sense for your situation. You should always feel like there's a reason behind what you're doing. If you're dealing with pain that keeps coming back and want a more structured, movement-focused approach, you can check out availability on this page. And if you're not sure whether your situation is a good fit, feel free to reach out. I'm always happy to help.